It is time for our weekly segment, Patel It Like It Is, where ABC News contributor Dr. Alok Patel shares health advice on the topics that matter most to you. And today he's answering some of your questions. So, Dr. Patel, let's get started, shall we? Erin from Wales, Wisconsin has a question for you. You ready?
Bring it on.
So, Erin wants to know, if your kid has a grandparent or aunt with celiac disease, does that mean the kids should get checked or maybe avoid gluten?
Well, Erin, not necessarily, but I do understand why people ask this question, because you may have a family history of celiac disease. You may be reading about it, and it can cause a lot of anxiety. Now, some people are higher risk, or they may have a predisposition towards getting celiac disease. And in these cases, there could be a conversation with your doctor. So people who are at increased risk include those who may have a first-degree relative with celiac disease. They may have autoimmune disease, just type 1 diabetes or thyroid disease. There's some congenital conditions like Down syndrome, or even some issues with your immune system like IgA deficiency. And in these cases, your doctor may have an individualized conversation and say, hey, you should get screened. But there is no definitive rule. And also, parents out there, please do not preemptively keep gluten away from your growing babies and toddlers, because as we talked about earlier, whole wheat is an accessible, affordable source of nutrition and fiber. So don't make any crazy moves without talking to a pediatrician or doctor.
Now, Carlin from Magnolia, Delaware asks, after surviving preeclampsia with twins in 2021, should I be monitored closely for heart problems?
No, Carlin, first of all, I salute you for asking this question, and I'm glad to know that her twins are happy and healthy, and so is she. Now, preeclampsia is a very serious complication that can occur in pregnancy, characterized by hypertension, kidney damage, and some other organ damage as well. Before we get to Erin's question, let's talk about some warning signs that pregnant women can look out for. And one of those, one big one, we mentioned hypertension. There's also headache, vision changes. There are some differences in labs that may show up, such as protein in your urine, breathing difficulty, nausea, or vomiting. And Diane, this affects 1 in 25 pregnancies and can be fatal if left untreated. Now, going back to Erin's question, American Heart Association and new research does suggest that women who have preeclampsia during pregnancy may be at a 2 to 4 times increased risk of developing hypertension or heart disease later on in life. So checking in with doctors and following a healthy lifestyle is really important. And it's important to know that this doesn't mean that this is going to happen to all women who have preeclampsia. It's just important to know that you have an increased risk.
All right, great to know that. And Michael from Los Angeles wants to know, what are the actual proven uses of medical cannabis in children?
Michael wants to know this, and so do so many parents and patients I talk to. Now, as of right now, there are only a few FDA-approved cannabis-related medicines or synthetically derived medicines from cannabis. And one of them is Epidiolex. That's used in children to treat a very specific type of seizure. There's also an example of medications that can be used for nausea and vomiting in kids who are undergoing chemotherapy. That's Marinol. But Diane, there is ongoing research in adults with medical marijuana to treat conditions such as anxiety, other mental health conditions, chronic pain. And as we get more information, there inevitably is going to be more data about safety, efficacy, and uses in children as well. And I will tell you from personal experience, I talk to a lot of families who have children who may have a very serious medical condition, even a terminal illness, and there are no treatment options, and they ask about medical marijuana or cannabis, CBD, and that's okay. It's important to have those honest conversations with your physician. It's important for physicians to listen and also talk to parents about it as well, and for parents to not self-medicate, because we just don't have enough information about dosing, efficacy, and long-term safety outcomes. But the conversation is evolving.
Yep, so important to have those conversations and ask those questions. Dr. Alok Patel, thank you.
Happy Friday, Diane.
Happy Friday to you. And if you have questions for Dr. Patel, we do this every Friday. So leave him a message on our Instagram feed at ABC News Live, and he just might answer your question on the air.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.